Welcome, and thank you for being here today. My name is Darlene Stromstead. I'm the President and CEO of the Mohawk Valley Health System. So we have some very exciting news to share with you today. The stroke program at the St. Luke's campus of the Mohawk Valley Health System has been designated a comprehensive stroke center. This is the highest designation given in the state of New York to stroke programs. It makes us one of only 7 healthcare facilities in the upstate New York that has this designation, and we are the only facility between Albany and Syracuse. This is a major accomplishment. Having a comprehensive stroke center right here in Utica means that the people in this region can receive the best possible care for stroke events. It means we have the equipment, the expertise, and the training to treat any kind of stroke or stroke complication. Achieving this designation is an important part of our strategic plan as a regional referral center. It is the result of years of work of a team of very dedicated professionals who always put our patients first. So we are very proud and grateful for the leadership of this healthcare team. Many of them are here today. And to speak more about what the designation means, I'm going to introduce Dr. Varun Reddy, who is the Director of Stroke and Neuroendovascular Surgery.
Thanks, Darlene. Thanks for the introduction. Thanks, everyone, for being here. And this is a very proud moment for all of us in the team. And I'm very happy and excited to share that the St. Luke's campus at Mohawk Valley Health System has received this highest level of designation, what is termed the Comprehensive Stroke Center. And what does Comprehensive Stroke Center mean? It is the highest designation that any stroke center can achieve, and it means the highest cream of the cream level of care that can be offered to our patients locally here. It is a very rigorous process, nationally standardized by the DMV and accepted by the Department of Health. And this recognizes the centers that have and can offer the most cutting-edge care, cutting-edge technology. And we are privileged to be one of only 7 centers in all of upstate New York to offer that locally in our own community. And what does this mean to our community? What does a stroke center, comprehensive stroke center, mean to our community? That when somebody, you or a loved one, is experiencing signs or symptoms of stroke, that this cutting-edge treatment can be offered locally here in the shortest interval of time, offering the most advanced treatment and in our own community's backyard. Does not mean that you need any transfer to other outside institutions, does not mean travel to any other institutions. Everything that's available with regards to stroke care can be offered locally here. As you all know, stroke treatment is very critical. Time is very critical. And we all say time is brain. It's almost 2 million brain cells that die every second that stroke is untreated. So getting help fast is important, but not only getting the treatment fast, but getting it at the right institution is sometimes even more important. And that's why we want to emphasize that the St. Luke's campus at Mohawk Valley Health System is that place of choice for our local community. So if somebody is experiencing stroke symptoms, this is the place to be. This is the place where we can offer the best treatment, the fastest interval. Also, what is unique to a comprehensive stroke center is the availability of some advanced technology, advanced imaging, advanced diagnostics. Some of the most minimally invasive treatments, surgical treatments for brain, like removing brain clots, treating the brain aneurysms, all of that are part of a comprehensive stroke care delivery, and that's available to us locally here at St. Luke's campus. And the comprehensive care doesn't just end in the emergency room or the neuro ICU. It involves, as the word suggests, it's a comprehensive approach. It involves very advanced rehabilitative therapies, access to some of the cutting-edge research trials here. Also involves very trained nurses who have expertise in that stroke care. It also means team care, right? It's a team approach where it's not just an ER physician that's identifying and treating a stroke, but an entire team that's involved to deliver that comprehensive care. There's 24/7 availability of a neurocritical care specialist, a neurointerventionalist like myself, a neurosurgeon, neuroradiologist, ER physicians, and stroke-trained nurses that are available 24/7. So essentially, all of these are, available to us locally, and we are very proud about this designation, about this certification, and we do want to, help keep our patients here locally in our community and offer the best care to everybody here locally. And I now want to introduce Jen Hurd, our stroke coordinator, who's going to talk about some of our community outreach and collaborative efforts with some of the regional hospitals. Thank you.
Good morning. My name is Jen Hurd. As Dr. Reddy said, I am the stroke coordinator. I get the privilege of working with all of our different teams across the healthcare system as the coordinator and bringing all of our efforts together. So I get to continually review the state and national guidelines, the American Heart Association guidelines, and the regulatory, and work with all of our teams from EMS to our emergency department physicians and our emergency team, to our providers within the health system, all of our rehab folks, so our physical therapists, occupational therapists, our stroke nurses, our rehab facilities, so all of our teams within the hospital, and keep us all heading in the right direction so that we can continually stay at the top of our game and stay at the forefront of research and the latest techniques. Outside of the hospital, our program also works with other facilities. So we, being a comprehensive center, are a resource to area nursing homes, other hospitals, community agencies, businesses, so that we can also help them to understand the importance of stroke, the speed with which we need to recognize and get our folks to the hospital, as well as helping them to develop their policies and protocols so that they can continue to keep their staff educated on recognition and where to send their patients to. So we also do health screenings and health fairs. We're out in the community trying to teach the importance of lifestyle choices and the fact that 80% of strokes are preventable. So it's also our responsibility and our privilege to work with the community on how they can improve their health overall, and hopefully prevent the need for our services, although so we want to be there available for prevention and for treatment if you need it. So we get to collaborate with many different people to make that happen. So like Dr. Reddy mentioned, time is of the essence, so every moment counts. So that's why we're here collaborating with all of our other team members to make the best available care right here in our own hometown without needing transfer. So it's very important to make sure that you get yourself educated on the signs and symptoms of stroke, and make sure that you call 911. So you never want to drive to the facility. We encourage you to call 911, and that again allows us to collaborate with them. They're giving us information ahead of your arrival so that we can be prepared and ready to go when you arrive. At this time, I would like to introduce Dr. Scott Braille, our Director of Medical Stroke Services and Neurocritical Care.
Thank you, everybody, for coming today. I am Dr. Scott Braille, Medical Director of Stroke and Neurocritical Care. This has been a journey for me. Started the stroke program back in 2006, and we were not a stroke center at that juncture, and we knew that we had a lot of strokes here. We know that this is a large population that is at increased risk. So myself and my stroke coordinator, Angelina Roach, started the program, and we went through the New York State survey. We were able to show that we can provide stroke care here, and at that juncture we became a primary stroke center. There were several stroke centers that were primary stroke centers at that point. There was not any such thing as a comprehensive stroke center at that point, and it was wonderfully received throughout the community. We worked with EMS, we worked with the ED providers, we provided a lot of education for the staff, and continue to try to evolve further to provide the best care. As everything in medicine evolves, the care continues to become more of an IV medication in an emergency to neuroendovascular treatment, because the medications just can't target every single place or the specific area where the stroke is evolving. And it was wonderful to meet Dr. Reddy and bring him on board to collaborate and to continue to make this program evolve further. And the continued education process is an ongoing process. And we continue to learn from this. We continue to try to bring the advanced care, but this process really starts in the field with EMS, and we're thankful for them. They're able to recognize stroke. They continue to go through training. They come to our ER. We quickly assess them. They're seen before they are even brought to CAT scan. We do an assessment. We do a quick CAT scan times brain. So to be able to provide this in the community as the theme that we continue to talk about is important. It's 1.8 million brain cells per minute, which can be lost. If we were to get those patients out to Syracuse, that would be many more brain cells lost, and patients would not do as well. So times brain, what we do for the patient in the first hour of that stroke really matters, and so we continue to focus on that. But there's a lot of individuals that really need a lot of thinking. It's EMS, it's our emergency room staff, it's our stroke nurses, it's our ER nurses, it's Dr. Reddy, it's administration, it's our stroke coordinator, it's our stroke nurses, and there's probably several names that I'm not going to be mentioning here, and I'm sorry for that. But this is a team, and it is a wonderful team, and it is wonderful that we're able to provide this for our community, to give our community the best care possible, and then to continue to evolve as the future treatments come forward. We will be providing those treatments as a team. Comprehensive Stroke Center has been a dream for me since I started this program back in 2006. So we are finally here, and I look forward to moving forward with what the future holds. Thank you.